Welcome to Bonafide HPP, a podcast designed to educate and support the patients and caregivers of those affected by hypophosphatasia. As a mother and caregiver, host Deborah Fowler has discussions about this rare genetic bone disease with people from around the world. Join Deborah now as she speaks with this week's guest.
My guest today is Dr. Jody Thomas, Chief Executive Officer of the Meg Foundation, a nonprofit whose mission is to empower families with pain management strategies, skills, and support they need to prevent and reduce pain. I can't think of a better mission statement for our patient community. And if that's not a hook for today's discussion, I don't know what is. Thanks so much for joining us, Jody.
Thank you so much for having me. I'm very excited to be here.
You know, I never heard of the Meg Foundation before, and one of our patients actually pointed it out to me online, and I just got lost in your website just with resources and just found so much awesome information. Can you tell us a little bit about how the foundation was founded and a little bit about your mission and what you do?
Absolutely. So I am a clinical health psychologist. My specialization is with medical illness and trauma and kids and pain. And as I don't have to explain to anyone listening to this podcast, how much pain with across various disease populations and even with perfectly healthy kids, how much of an influence it has on the daily experience. And no matter what disease was happening, that it was really painful procedures that become such a big part of patients' lives. And so that became a really huge area of interest for me. And, I've been doing this for 25 plus years, which is crazy. But a few years ago, we really knew that in this age of technology and design and communication and podcasts and things like that, I often kind of joke that people don't need me, they need what I know. And what we got this amazing group of experts from literally around the world. And I was hanging out in the middle of Silicon Valley and technically still on faculty at Stanford, even though I'm now in Denver, but I still teach. And so I was in the middle of Silicon Valley and all the tech people and user experience and all that. And it was really, how do we kind of bring sort of cutting edge science, technology, and design together to get the information and, very importantly, skills to people when and where they need it. And our desire and mission to do that really became the basis for and the motivation for the foundation.
Well, it's such an inspirational mission. And I think it just cuts across so many different disease states, right? So many therapeutic areas. Even in our daily lives, right? It doesn't even have to be related to disease, right?
No. And what really our motivation came because as I was going through realizing that there's this massive, massive gap between the research, it's about a 30 to 40 year gap between what clinically happens and the research in turn it comes to pain and pain management. And when we can close that gap and we can get people to know these skills, that it's quite literally life-changing. And so that really became this mission of how do we get the average everyday parent and human to know and understand these things in order to improve their experience as a parent, the child's experience, and honestly, the provider experience, because no provider likes causing a kid pain and distress. And we really wanted to improve the experience for everyone.
Yeah. I'm sure it rolls off your tongue, but this, biopsychosocial modality of pain. And that's really, a big focus of understanding that. Can you explain it to us for those of us who are more of a lay audience about what this really means?
Yeah, I haven't spent 25 years dorking out about this. I will do this. So I wish, and it's funny, we're working on a whole education series right now about this, because of course we hear a phrase like biopsychosocial model of pain and most people just stop listening, which I totally get and understand, but it's really important. So what we're really saying is that traditionally people think of it as what we call a biomedical model, that there's tissue damage and then that hurts and that's it. And then we take care of that tissue damage and it gets better. But that is not in fact how it works. And we all know that, really, if we think about it. So the biological components of pain are, what's actually happening with, a needle going into a skin, or an injury happening, or inflammation, or all those things. But there's also like how stressed we are, any infection in our body. There's a lot of biological factors of the pain experience. And that's kind of the obvious one. Everyone's like, yeah, I get that. The psychological factors are the one that people tend to react to. They're like, wait, you're saying I'm crazy? I'm like, no, I'm saying that every single human on the planet, their psychological state, their focus of attention, all of this has a massive, massive thing to do with how we process and experience pain. And one of my ultimate examples I'll often give is, have you ever noticed that when you stub your toe and you're in a bad mood, it hurts a lot worse than you stub your toe when you're in a good mood?
It's a great example.
And everyone's like, oh my gosh, yes. I'm like,
Yes.
okay, great. So let's take that and take anything that actually has so much more import, whether that's chronic pain or procedural pain or whatever it is. And that is still true. And all of us know the power of focus of attention in pain. When we work with kids, we say, have you ever at the end of the day had a bruise and you didn't even know it was there? And they're like, yeah, I had no idea where I got it. It's like, yeah, that really tells us how our focus of attention, that you were playing so hard that you had this experience that you didn't even notice that you had enough quote unquote tissue damage, right? Like you got hit hard enough to get a bruise and you didn't even know it happened. Mm-hmm. So I'll often ask them, I said, so if you think your brother or sister came up and hit you hard enough to create a bruise, would that hurt? They're like, yes, like exactly. So it's this massively important role of our focus of attention in how we attend to pain and what we think about pain. And that psychological piece, frankly, is really, really exciting because we have lots of room to mess around with it and lots of room to do things to make ourselves more comfortable. And then we have this social aspect of pain, which is the one that everyone really is like, wait, what? And I think about that even as like small toddlers, when you see with kids like learning to walk, run and fall, and they're on their hands and knees and they will look to a parent.
Yeah. And
if that parent rushes over and says, oh my gosh, are you okay? Are you hurt?
Yes.
Then we have the tears and the freak out, right? And if we look at them and you see a parent, again, like if we're not bleeding, right? Like what's happening, being like, hey, bud, that was quite a tumble. Good job. You're good. Yeah. Then we get up and we're fine, right? And that isn't faking it. That's not manipulation. That's not anything. That is truly how we do. And anyone who's been in a medical setting knows what it's like to be with a provider who is empathetic and understanding and you feel connected to, and how that feels very different than someone who you realize is not connected or you don't trust or is acting in a way that's scary or frightening, that we're going to escalate, right? And that is going to be extremely different. Or the person who, again, if I'd strike this from providers' lips, I would, who's really invalidating. Oh, it's not that bad. Don't worry about it. Or you're overreacting, or all of those things, that social experience of how people are responding to it, which I think is really relevant, of course, for your population, which is when you're the parent who has to do these injections, the role of you in this is very large. And just to be extremely clear, really hard. Okay. Yeah. Nowhere in any of these discussions I have with people are like, oh, so then it's no big deal. You're like, no, because it is all of these factors, it is really hard, but we have distinct strategies that if we're thinking about it in those three categories, it really does help us figure out, okay, how can we make this better?
Yeah. And there are things we can do for each one of them, right? I mean, even for, I know I talk to a lot of parents and even adults who may be afraid of injections, with my son, Cannon, the numbing spray, just the fact that we would put that numbing spray on, he wouldn't do an injection without it. But then if he had it, he was okay. Yeah. And it was like, oh, where's my spray? Where's my spray? The spray, even if it was like almost out of spray, it was like
exactly. And so
thing that he was putting spray on there made a huge difference.
It makes a massive difference. And it's a beautiful look at that biopsychosocial model, like numbing cream and numbing spray, because yes, you are actually numbing the skin. You are actually do something to those nerves to decrease what we call nociception, or those signals traveling. But you are also in control, making a choice, doing something active. You would say action is the enemy of anxiety. So your son got to make a choice and do something, and that reduces it. And then you as a parent are supporting that and saying, yes, I know this is hard and we're going to do something. So that's where we feel supported socially. We feel like we're doing something psychologically, and we're actually blocking a pain signal physically.
I love that. I love that interpretation of it, because it's leading me to think of things that we're doing that I never really thought in terms of this biopsychosocial model. Like, for example, he always wants to count down to the injection.
Uh-huh.
So it's not just me going, all right, 1, 2, 3, boom. You know,
Yeah.
he has some control over this process. And you know, I don't, again, I never thought of that, but
exactly, right. And that's where we think the power of this model, it just gives you a new framework, because a lot of families with chronically ill kids, like, have developed their ways, right? They've figured some stuff out. But looking at it through that lens helps you figure out, okay, what about this is helpful? And then how can we up the ante of whatever is powerful about that, right? And like, again, that countdown is about control, and it's about choice. And I may not have a choice that I have to get this injection that I hate so much, but I have a choice in how we're going to do it. And that, the power of that is massive.
What other ways can you have any other kind of tips and tricks for, I know there's a ton on your website, but, you know, I'm just thinking for those who are listening,
Yeah.
a lot of times that these are children that are either just diagnosed or are, you know, just been prescribed injection therapy for their enzyme replacement therapy. And, you know, it's not an easy injection. It's a very thick, viscous, you know, injection, and it's something that should be done slow, and it stings, and, you know, it's not fun.
Yeah.
And I think parents, you know, they know that their kid, that this is what's best for their children in terms of their health, but it can be a real struggle. And, you know, the kids, you know, as we were talking about before the podcast, they can have superhuman strength when they're
Yes.
there's a parent off of them.
Yes.
You know, and they get beyond the child hold, you know, where they're younger, when they, you know, they want to run away, and they very times are successful in doing so.
Yeah.
So, you know, how do you, again, I know this is not the first time you've ever heard of this. So
No.
what do you typically tell families who are in these situations? What kind of advice do you give them?
So there's several things. First of all, that I have ultimate empathy for this situation. Like, it is really hard. And, you know, I'll often use the phrase kind of space and grace, but space and grace for ourselves as parents and for our kid. And so recognizing the difficulty of that, I know a lot of newly diagnosed parents in particular will get I should know how to handle this, which was always such a bizarre statement to me. I'm like, why would you possibly know how to handle this? Like, when you had your child, you did not expect this to happen. Like, of course not. You have to develop a very particular skill set now that I wish you didn't have to develop, but you do. And to really think about this isn't us being incompetent as parents. This isn't us doing that. It is, I have to, as a parent, develop this very particular skill set, and my child has to develop this very particular skill set. And to recognize both the necessity of that and the unfairness of it, right? Because like, it's not fair. And I'm like, you're right, buddy, it's not. And I'm really sorry, but we don't have a choice about this one. So let's think about all the things we're going to do to make this easier, better, and faster, and to give you as much choice and power as possible as we can. And that is true, by the way, even when they're those little toddlers and up to those teenagers, right? It is true all the way across the board. And with toddlers, really remembering that what we call receptive language develops more quickly than your expressive. So they understand a lot more than we often give them credit for, because they're not chatting away in the same way that we do. But having a plan and stepping back and being like, okay, we're going to figure some of this out. And when we're looking at things like really explaining why and how we have to get this, even to small children who you might not think understand it, right? Is to be like, hey, buddy, I know this is tough, and we're going to be able to, but we got to do it to keep you healthy and strong, right? The use of language becomes really important. So I remember I had a great kid who taught me this many years ago on that ability, and he started calling his IVIG infusions his liquid gold. That he knew this was the stuff that was going to keep him healthier and keep his disease at bay. And so even that concept of this is the medicine that keeps us more healthy and more strong. And we always want to be more healthy and more strong. And that's tough. And we wish, and so we're going to skip over. And that's really that focus of framing this experience and framing as an experience of not a dread, because really we get ourselves into that hole when it's just a moment of dread for every time we have to do it. Right. Because then everyone's in a bad spot.
Yes, totally.
And it's really easy to do. And again, I do not say this simply at all. But we have to be like, it has to get to that point where it's becoming something like brushing our teeth or getting dressed, like all the other little things we have to do the day that we don't want to do, but we got to do. And this one is tougher. So it deserves more reward, more motivation, more, all of those things, but sitting there and having that plan, and whether that's with our partner, with little kids, right? If we have one, and sit there, be like, okay, how are we going to do this? Because you're right. Like I joke that like toddlers are trained by Navy SEALs, that their ability to to escape and do things, and but
they're
part
very
of that,
elusive, and
they're very elusive,
yes.
but they also, it speaks to the very primal nature of that fear, that we're really at that worry brain. And so we know that your worry brain is telling you to run away, but you and I know, the real you knows we got to get this done so we can be healthy and we can move on with our day. So setting up plans, setting up expectations. Okay. So this is when it's going to happen. This is it. And also setting up rewards, more than fine. And parents like, oh, aren't you bribing them? I'm like, no, we're getting us motivation for getting through something that's hard. We all need motivation for getting through something that's hard, right? Whether that's as an adult being like, great, I'm getting Starbucks after this meeting because I got to do whatever that is. So setting up expectations, having things like calendars where they get to plan, and then planning our strategy. So topical anesthetic, numbing cream or numbing spray is really fantastic, particularly for things that like again, this injection can sting, right? So things like vibration can be very useful, because to experience pain, it really has to happen in our brain. And so one of the things we're doing is preventing those signals, or the strength of those signals, to getting to our brain. And so when we use vibration, like there's a great product called Buzzy Bee, but there's other things as well, where you're using vibration to essentially create a traffic jam of signals on your nervous system. So you don't have to feel that sensation in the same way. Sometimes it can block them entirely. It's really great for like blood draws and things like that too. Yeah. So vibration is very, very powerful. Distraction is massively, massively powerful. So everyone knows the difficulty in getting your kids' attention when they're staring at a movie or a game or whatever that is. And now is a time to take advantage of that superpower. Now, as kids get older, and even little kids, of explaining to them that not is only distracting them, like, oh, they just didn't look, but it truly changes our processing of our pain signals. And that is a very powerful idea, to be like, when you focus on that, you don't experience this in the same way. So let's do it on purpose. Like I will tell kids that I cheat, because I'm going to teach them how to do something that they already know how to do. I'm going to teach them how to do it on purpose to make themselves feel better. Right. And so let's make that choice. So, okay. So when we do our injection, we're going to watch Peppa Pig. We're going to use numbing cream. We're going to use Buzzy, whatever that is. And then this is how we're going to hold you. Okay. Do you want to get held like this? Where there's something called comfort positioning. We should really, really work unbelievably hard not to hold kids down for medical procedures. I understand that's also a really tall ask and a big thing, but there are comfort positions. We have guides on our website but there's also consent to be like, I know that your worry brain or your lizard brain is going to tell you to run away at this point in time. So this is where I'm going to hold you and remind your body to stay still. So we can get this done as soon as we can, and it'll be over. Right. So, but this is me helping your body stay still so we can do this, rather than I am holding you on your back.
Pinning you down.
Yes. Pinning you down.
Right. I love the idea, even of having a number of different comfort holds and having the child pick which one. And again, this is obviously age dependent, but, there are other things I'm thinking you could even do with younger children, maybe I'm thinking out loud, but, maybe you put a sticker on each one of the syringes and say, which sticker do you want? Ariel, the mermaid, or do you want, Cinderella, or,
100%. This is where we like, which one do we want to get?
Yeah.
And this is the time where we go to Walgreens and pick out every single kind of cartoon Band-Aid that they would want after, so that they get to choose every level of choice they can have. And who do we want? I want to hold my stuffy while I do this. I want to do this. And actually, it turns out I want to watch this show. I want to be in my bed. I want to, wherever they want to be, that is comfortable, good. And sometimes you're like, well, you should never associate the injection with like a safe place like a bedroom. And I'm like, well, maybe not. It really depends on what is comfortable and good for that child.
What's going to make them feel the most comfortable.
Yeah. But you could be like, great. Do you want to do this in the living room, or do you want to do it in your bedroom? Is this our spot? Do we want to have our special little area where here we keep the Band-Aids, here we keep this, that, oh, we got all of our syringes today. Great. Let's go. When we're not doing the injection, we're going to go through and decorate them all. You get to put a sticker on each one. And then you get to choose, okay, which one's first? Oh, it's Ariel today. Brilliant choice. Amazing work. Good job. Cool.
And maybe you put Ariel on the TV while you're doing the
exactly. Be like, sweet. Do we want to do this? Awesome. Exactly. That same thing where and every single choice is a moment of praise and a moment of what a great job taking care of yourself.
Yeah.
That is brilliant. And having that be a special, cool thing, that also great. And to have a reward after that, whether that is small, whether that is like, great, we put a marble in a marble jar, and when we get this many, we get to go pick out a toy, whatever that is. But it becomes so powerful to be able to have them have choice and control. The other part, the number one advice I give parents, which I also realize is the tall order, is the number one predictor, the research would say, of a child's distress is the parent's distress. And that makes sense, right? And again, parents are sometimes horrified initially, and they're like, does this mean this is my fault?
It's my fault.
No. So again, to be clear to all your listeners, no, it doesn't. What it means in a gorgeous, beautiful way is that you and your child are attached. Good job. Gold star. That's what we want. That is great. But what it means, it's another opportunity for us to be able to do something to make it easier. So this is that moment when we're like, okay, I've got to take some breaths and center myself. I have to remember that I'm doing this for my child's benefit, and this is going to be helpful. I have to remember that we made a plan, and my job is to stay calm and even and to be reassuring, right? And our use of language and the words we use become really important. So saying things like calling it a poke rather than a shot, calling it, whatever, an injection rather than whatever, but even asking kids, what do you want to call this?
Get creative.
Yeah. And the magic medicine. Okay. We get to get our magic medicine right now, so we can do this. Fantastic. Great. What are we going to do after? So that's the other thing we can do when we talk about things that project into the future. Great. So after we're done, are we going to finish watching? Did you want to finish watching all of the Little Mermaid movie? Or did you want to do something else? Okay, cool. Also, predictability, particularly with an injection like this. So like when we started doing COVID testing, one of the things we tell parents as a piece of advice is because you have to have that swab up your nose for about 10 to 20 seconds.
It felt like eternity.
It felt like forever, but we would have them sing a song. And so the kids knew when the song was over, it would be over. And so we can just count it out, but they knew that, right? So it's like, okay, great. You're right. It's not very comfortable, but guess what? By the time I finish singing my song, we're done and we're at, and we're talking about having to do slow injections, because what we want to know is when it's going to be done. We can tolerate anything as humans if we know it's going to be done.
Right.
And to be like, great, okay, cool. Do you want to? And also giving them permission for distraction. Either I don't want to pay attention at all. I would like to pretend you're not doing anything at all. Great, cool, good. Or I want you to tell me when it's going in. I want you to sing the whole time. Like you mentioned, your son wanting to do the countdown. Great. Do you want to do the countdown? Do I want to do the countdown? So we have poke plans and those things on the website that allow kids to say, do you want someone to talk? Do you want them not to talk?
Some of those questions to ask are where those areas are where you can have some control.
Exactly.
That's great. Does it change for older children, teenagers, or does it change? We have obviously a lot of this drug's been available now for 7 years. And now, some of those kids who were kids back then, like my son, who's now just turned 17,
Uh-huh.
trying to transition to do their own injections. That's another, form
Yeah.
of independence. And, he'll have to do that when he goes to college or goes to camp or whatever. And so I'm just curious about, that are there similar techniques, tools, resources when a child is starting to potentially self-inject?
Yes, there are. So one, they get to know and they get to be kind of praised for their choices and what they want. But that's also honestly to really frame for them that getting to do your own injection is them having the most control.
Yeah.
Right. They control the speed, they control the location, they control the timing, they control any of it. And developmentally, that goes very much along that level of independence. Now, I've taught kids, hemophiliac children as young as, 10, 11 years old, how to self-infuse. And that's hitting an IV like that. So that's hard. That's a skill set. But when we're able to frame this as an opportunity for power and control, an opportunity for independence, but also this is the age, and I think your population is a great example. Like I used to work a lot in the transplant population, and these kids often would get transplants as small children, and then they would age up. But nowhere along the way did anyone sort of stop and do re-education about why they're doing this protocol. Because what we explain to a 6-year-old is different than what we explain to a 17-year-old or a 15-year-old. And we forget. And the example I give of that, and I'll look at parents and providers and say, they don't have no idea why they're doing this medication, like how it works. And they're like, well, how can they not know? They've been doing it for 7 years.
Well, no one ever told them.
And I was like, look, so I'll tell the story. I said, look, when I got my driver's permit, I got in the car to drive for the first time. And my mom said, great, let's go to your, the grocery store. And I was like, great, how do we get there? And she's like, how do you not know how to get to the grocery? We've been there 8 billion times. I said, yeah, but I was never the one driving.
Right.
Yeah. And so
I went through it with my son. That's hitting home for me.
Exactly. Right. You're like, oh, and especially as kids get older for things like this type of medication or injection, literally, how does it work? For those kids being like, it's not like, hey, this is magic medicine that makes you healthy and strong. But you're like, how does it make you healthy and strong? What does this do for us? How does this work? Understanding the science and understanding this for a lot of kids can be really helpful. Not universally, by the way. Other kids are like, I don't care. I'll do it because I have to. Don't talk to me about it. I don't think about it.
Exactly. Out of sight, out of mind.
Out of sight. And that's also fine.
Yes.
But I also think the thing that you mentioned in our conversation too is being able to support each other. As kids get older, our ultimate belief as teenagers and any normal developing teenager is to feel like we're alone and that no one shares our experience. Mm-hmm. And you take that to chronically ill kids who are dealing with things that most healthy teenagers could only imagine. And that is, exponentially increased. And so when we can have kids who truly do get it, even as parents, as empathetic and as caring as we can be, we don't get it. We don't know what it's like right now to be 17 and having to do this and doing all this piece. And so connecting them in these really positive interactions where they can encourage each other and give each other their own tricks and tips of how do I do it? What do I think? How do I get through it? Is so much more powerful than any adult is ever going to.
And that's what I love about what the teens are doing on the Teen Advisory Council that I was mentioning to you again before the podcast. But they're all coming up with what worked for me and sharing that. So for my son, he said, I liked listening to music that got me really pumped up to do it. So he had like a pump up playlist that got him all psyched, almost like before a basketball game.
It's brilliant.
Going out on the course. It's like that motivational music to get you ready to go.
And it's changing his psychological state. And that's exactly what it is. Like we all know the power of music. And so when we have our hype up music, our conduit, it is, and again, it is literally changing the way his body processes that pain signal and what happens. It is a brilliant strategy. And you're like, fantastic. That is incredible. And it's such a great way to be like, yeah, you did it. You changed the way that your body's going to process and deal with this.
And to your point about the social piece, I just find it so fascinating. The story that I shared about the mom who whose daughter wouldn't inject in her thighs, and just, she was no way she'd inject in her thighs. She'll inject everywhere else. And the doctor was really saying, you got to rotate your injection sites. We're going to see some lack of efficacy of the medication if we don't start rotating.
Mhm.
And she was at her wit's end and just said, is there any way that, one of the kids from the TAC can talk to him? And so we got on the phone and did a little FaceTime call, and said, it's funny because my son said, my thigh is my favorite place to inject. That doesn't hurt at all. And that little conversation coming from a peer versus from mom, it completely made the difference. And to your point, just whatever it was, it changed the way that she was processing the pain.
Yeah, it is. And we're creating a shift in how we're thinking about it and our openness to it. I think it's a gorgeous story, and it's really so indicative of how this works and how powerful it can be. And to be able to turn around and say things like, you have actually left nerve endings in your thighs. So that might be more comfortable on these days.
Yeah.
And we even talk about little kids, because again, that need to rotate that's another choice they can make. And you even had like a little body, and you're like, we did the butt last time. So, what do you want to do thigh or arm today, or whatever that is? And again, like, especially since it can go into different body, this is a great time for body humor jokes. And anytime we can inject humor into any of this,
we'll take it.
Such a gorgeous way to take out some of the anxiety and stress.
Yes.
And to allow for a little emotional space to mess with. The other thing I was going to mention about, because what you're talking about with the teenagers gives them control when they're sharing with peers, and they're being able to share their story and get really validation of their experience. With small children, play is key. Mm-hmm. When we're working out our plan, we're doing our things. And this is when getting that medical play kit, whatever, kids will make up things with whatever. Here's the pencil that's now a shot. This is now my stuffy that's getting their poke. Mm-hmm. That maybe even part of the ritual is the toddler does the poke on their teddy before. So both you and Teddy are getting your poke, but you're going to do the poke for Teddy because you do such a good job of making them comfortable and making them strong. So that's so brilliant. Do you want to do the same arm as Teddy today, or do you want to the same place, or do you want to do something different? Does Teddy need an aerial band-aid, or does he want a minion one today? That is how we work out our feelings as kids. They can't turn around and talk about it.
Right.
But that is a brilliant way to have aspect of control. And it's a great way to show them a plan without having to do it on their body. And kids are always paying attention.
That's brilliant. I love that. One other group that I don't want to leave out, we have a lot of adults who are diagnosed very late in life, mm-hmm. become candidates for enzyme replacement therapy. And you've got people who've, never done an injection on themselves before. Some people are very needle phobic, or become needle phobic because the idea of giving themselves an injection is really terrifying.
Yeah.
How is it the same for adults as it is for kids? Are there other resources or other things we should consider?
First of all, they're similar and they're different, because adults tend to have tremendous amounts of shame about this. And the truth is that needle fear is an incredibly common problem with adults in general. Mm-hmm. 1 in 4 adults has enough needle fear to change their healthcare decisions. Mm. Okay. So when I was joking, I bet $1 for every adult that told me that they had this issue, but no one else they know does.
Yeah. Well, that's what I was going to say.
I was like, unless you are a hermit in the woods, this is statistically impossible. We just don't talk about it at dinner parties. Exactly. And this becomes a really big mission actually of the foundation, is to get this topic out and to take away some of the shame of all of this. And the truth is it's really common. And so full needle phobia should, and especially if we're going to have to do things like learn to self-inject, seeking the help of mental health providers who can do full-on exposure therapy, where, and that is simply when we start exposing ourselves to different level of whatever the feared thing is. So like in the case of needles, it might be like the first step is even thinking about a needle. Okay. And allowing that feeling, because we are physiologically unable to stay completely stressed and panicked. And basically it's about reassociating some of those things. But it is important. And the thing we have to remember, and again, so along with our mission of an organization, is it the reason that that fear exists? The reason we all can think of someone right now who is a full grown adult who quote unquote doesn't do doctors, right? Which the chronic illness population has no luxury of doing, right?
Yeah,
but we all know that,
right.
that person who doesn't do doctors, and they don't do doctors because of something that happened when they were about 4 or 5 years old.
Yeah. It's like a PTSD, right?
It is an actual PTSD reaction. It is a trauma reaction, which is why everyone's like, that's not logical. I'm like, of course it's not. But in case you haven't noticed, human beings aren't. We are not rational, logical creatures. And fear is not a logical, rational response at all times. So one is to kind of get rid of the shame. I love it when high profile people talk about needle fear and anxiety. There's a great video that went around a little while ago about an NBA player who needed his teammate to come help calm him and hold him when he got an injection. Prince Harry talks about being afraid of needles. So this happens a lot. So first of all is the shame. The second is to know that these strategies are really helpful. I have adults who will be full on in tears to know that like numbing cream exists.
Yeah.
Buzzy bee is helpful. Like that vibration is not only helpful for the pain factor, but it's also helpful for passing out. So there's a lot of anxiety often around the vasovagal response and losing consciousness. So learning strategies around that. And a lot of it is about advocacy and using our voice. And that's true for our teens who are transitioning into their own care, and for adults to learn to sit there and say, you know what? I get worried about passing out. I need to be able to lay down. Hey, I put numbing cream on this arm. This is where I want to do the poke today. Hey, I brought along my vibration. We're going to do this. Hey, my friend is going to come and rub my back and hold my hand while I do this, because touch is so powerful.
Yes.
Right.
It's like, just like when you want to hold someone's hand when you have an injection or going through something. Yep.
And again, it really literally changes our body. We have a rush of chemicals that come into our body. It is that those calming chemicals come in to override that cortisol and those stress hormones that are popping up.
Yeah.
And that touch, music, all that. So a lot of the similar strategies, but also that face of like, there's no shame in that game of using this and figuring out, but there are a lot of people, and also employing other people to come in and help you out, right? Especially as we're learning to self-inject. It is hard. You know, it's like, it doesn't hurt that bad. I'm like, first of all, you don't get to determine that for another person. But two, no, needles don't necessarily hurt that bad, but they bother us a lot. And that is a very normal response. That what we really know is your desire not to do this is a primal, normal, self-protective response. It just happens to be not helpful in this circumstance, right? Because
exactly.
so it's not weird or crazy. It's just, we have to find a way to get around it. And that's that issue. That's, we have to find a way to get around it to do what we need to do.
Yeah. It's really acknowledgement, right? For these adults, that to your point, it's the shame piece and getting over that. And then thinking about all of the other pieces, you know, what's really bothering me here? What am I afraid of? Thinking about each one, and then providing that right kind of cocktail of comfort, you know, to help you to get through it, to get on the other side, and, you know, reward yourself, right? You said, go to Starbucks afterwards.
Exactly. Yes, I will get that thing. I went through a week of this, or I did my first week of injections. I'm going to get that new gadget. Thank you very much.
Put things in your Amazon cart and then
you're like, as soon as I'm done with this, I will press purchase. Yes,
exactly.
No, it truly is really, really powerful. And that's the thing. You're like, and there's no shame in it. You're like, oh, I shouldn't have to do that. I'm like, why shouldn't you? This is really hard.
Yep.
We all need motivation to do hard things. That is not weird at all.
Agree. Well, this has been awesome, Jody. I'm just so grateful for you, for the foundation, for all these resources, because I said I knew when we started going down this path with injections that we're not the first disease group to ever have injections, and we can learn from each other. We can share what's working. And I just am so grateful. It's been such a fantastic discussion. We could go on all day, really.
Okay.
It's an incredible wealth of information.
Well, thank you so much. And please, I want to encourage your audience, if there's suggestions they have, questions they have, please do reach out. Our website, also there's email address on it. Feel free to reach out and ask us. We really do want to know, and we want to help.
I appreciate that. Thanks again, Dr. Jody Thomas. So for more information, you can go to megfoundationforpain.org. And you've been listening to Bonafide HPP, a podcast of Soft Bones, the U.S. Hypophosphatasia Foundation.
Join Deborah and other patients on HPP and Me, where they continue discussing questions around hypophosphatasia and submit questions for the next podcast. Go to softbones.org and click on Community, then HPP and Me for instructions on how to sign up. This podcast and the intro music was produced and edited by me, Patrick Jaguar.